components of iCCM actually have been already widely evaluated. So you don't need to evaluate again this. For example, IFCI has been widely evaluated, supervision, not so widely, but there is some evidence there, protocol systematic supervision. So data workers, there is another company systematic review. So there is some evidence around that you can use it, so you don't need to repeat this, unless you think that you will provide more knowledge. And then there are nice designs. You don't need to do always a double-blind randomized controlled trial, but you can do some other nice designs adapted to the reality, to the operational context where you are working, which can give you some reasonable results. Also, another thing that we have learned is that the quality of evidence is not related to the expert platform. So that the quality of evidence that is not strictly related with the strength of recommendations. You can have poor quality evidence, but for operational reasons, you may issue, as a Ministry of Health, for example, a strong recommendation. Or you may have strong or good quality evidence, but for contextual issues or cultural issues, you may issue a weak recommendation. So this is just some examples that I have written in the document, and it's just to show you, if I can be honest with you, the weakness of the evidence that we are dealing with. But the last bullet, you see that some people are able to do a kind of a randomized experiment or quasi-experimental design. But you get some statements that really are difficult to justify. For example, so just in 2 seconds, I show you here one way, not the unique way, not the best way, but this one way that we are working in relation to vaccination and communication interventions. Because we had similar problems. So we did 2 things, or we are doing 2 things. One thing was to do a taxonomy of interventions. So we look at the literature and we try to make a classification of what is communication, how does it work, how people understand communication, just to make a classification that later on allow us to understand the evidence that we read, and the next one, and the last one. And then we have also mapped the evidence and mapped the outcomes. We have been looking in the literature to see what outcomes are people measuring, which countries, so as to help us then later on to see the gaps where that we need to fill with more evidence or more experiments or more operational. So what could be ways forward? And as I was telling you, I'm not an expert in your area, but certainly there is some work, and I see that there has been some work on having an iCCM framework. You can also establish, a taxonomy and a better definition of what is this about, and you can set up somehow standards because you are the iCCM community. Somehow not somehow, but it's your responsibility as well to set up standards. What are the minimum requirements of a good iCCM evaluation, and what are the minimum requirements for a good iCCM evaluation reporting? Because we know that there are many things that are happening, but they are not reported. And finally, you may think, as some other people have done in the area of health systems, to have a kind of a single repository of this evidence, a single place where everyone that wants to know about this can look at this evidence. Thank you.
Thanks very much, everyone, for presenting your experiences from your programs and countries and from the research perspective. We wanted to reserve the next 10 minutes or so for our people in the room to be able to talk to each other about the challenges and the successes that they're facing. So Abigail is passing around right now a small discussion guide. It's only 3 questions. And I'd ask that everyone in the room find one person that they're sitting next to. If you speak French, you can move a little bit to find someone that you can speak with more easily. And the questions that we're asking you to answer for yourself today and to learn from each other are, what is, for your country's iCCM program, what's the greatest challenge you face in human resources? Following on to that, what's one strong practice you've put into place in your program that's addressed some of the human resources challenges that you think has been really successful? And then finally, what's one question that you want to ask the presenters? So we'll have a period at the end where everyone will come back up and you'll be able to ask a question of the presenter. So after you discuss amongst yourselves, we'll have a few people share some of the experiences, some of the exchange that you had, and then we'll collect the questions and people will have a chance to respond. Once everybody's received the discussion guide, you can already go ahead and turn to your partner next to you and start to begin to discuss. We have 10 minutes for this, it's just a brief discussion.